He's going to introduce our amazing panelists. So Doc G, take it away.
Yo, what's up? Camp Mustache 2020, the virtual edition. I am so happy to be here. I am Doc G. I'm the host of the Earn and Invest podcast, and we have an amazing panel and a bunch of amazing experts who you can see right now on your screen. But before I introduce them, I want to tell a little story. So bear with me for a minute. My wife was crying. No, really. My wife was crying. It had been a hard day, in a hard week, in a hard year, and she was ready to leave this job forever. She had been working nights and weekends, and the politics, it had finally brought her to tears. And I have to admit, I was a little excited, because we have been financially independent for years, and I have been sending her Mr. Money Mustache links and podcast episodes, and she would look at them and say, and then say no more. So I've been biding my time, waiting for this moment, and we were there. I could barely contain myself, and then she did the exact opposite of what I expected. She said, yeah, I've been reading all those articles, but the truth of the matter is, I really love our health insurance. You see, we were getting health insurance through her employer, and my son had just been diagnosed with a chronic illness. Thank God he's doing fine, but there are going to be procedures. There are going to be meds. Who knows what the costs are going to be in the future? And this health insurance plan was perfect. It had a low copay. There was almost no deductible. We could go to whatever doctors we wanted to go to. And when I thought about it, I'm not going to get a subsidy because I'm still consulting and making money. It'll probably cost me $25,000 a year for our family of four to get health care. And if I'm having this conversation at home with my wife, I can only imagine around the country, around the world, how many people are slipping and falling with this same issue, which makes me question, is health insurance the great financial independence killer? Is it the fly in the financial independence ointment? Well, to answer that question, I have an amazing group of panelists here with me today. So why don't I introduce them? Lynn Frair is a nurse and healthcare expert who faced financial disaster in her 20s after a brain tumor wiped out her savings. She is founder of the immensely popular website phihealthcare.com and someone I am proud to call a friend. Lynn, say hello to Camp Mustache.
Hi, Camp Mustache. Happy to be here.
Now, people may not know this, but I hear others refer to you as Mama Frair. Where did that come from?
Doc, it's Mama Lynn. And I think that it's because all the kids in the neighborhood started calling me Mama, and that was awkward. And so I had to become a specific Mama. And I've heard these really nice compliments lately, particularly in the last year, that I'm both warm and strong. And I think that is a really profound compliment. And so I feel like Mama Lynn encapsulates that.
Well, if you can't ask Mama Lynn about the tough questions like health insurance, who can you ask?
Yeah.
Rosemary Fatheringham is an FNTP who teaches people in the financial independence community about the preventative side of healthcare. Rosemary, it's nice to meet you in person. We've never met before.
Yeah, well, kind of in person, face-to-face, screen-to-screen. Lovely to meet you too.
Tell me what this FNTP thing is. I was thinking that was like Myers-Briggs, like ENTJ or INT. Like it too.
Yes, no, it's a functional nutritional therapy practitioner is my certification.
Awesome. I'm looking forward to talking more about that. But last and never least is Jackie Cummings Koski. She overcame poverty, divorce, and single motherhood and still became financially independent at the incredibly young age of 49. Lynn and I had the pleasure of sharing the stage with her at the Economy Conference in March. Jackie, what's up?
Hey, how you doing, Doc G? I'm glad to be here today. And this whole healthcare thing is a big deal, and it was a big deal for me too. So I'm excited to talk about it.
Yeah, I'm really ready to talk about that with you. I know you went through a bunch of changes recently in your work-life balance, Before we get to that though, you have like this obsession with giving away $2 bills. Tell everybody about that.
Oh gosh, the $2 bills. I wish I had one with me. But basically, the $2 bill is how I first learned how to save. So I started that in high school, through college, and through adulthood. And I guess I figured they were special. And when I look back, I realized that that was the first lesson I learned about money, is saving. I saved those $2 bills even when I was growing up in poverty, poor college kid, and throughout life. So when I finally counted them, I had about $3,600 worth of $2 bills. Crazy, right? So as I do financial literacy classes, personal finance classes, I give away those $2 bills because I couldn't imagine just spending them. They were very special to me, and I was only going to do something special with them. So when I do my classes, if there's great questions or great answers, I'm giving you a $2 bill.
All right. Before we jump into it, I just want to let everybody know there is Slido out there. Joe talked about it before. You guys have been using it up to this point. We are going to run this panel for 30 to 45 minutes, and then Lynn is going to take over and grab your Slido questions and throw them out to the panel. So please interact with us. If we are not talking about them in the first 30 minutes, don't worry about that. We will get to them. The other thing is I have prepared extensively for this panel, but the way I like it is the panelists have not. So give us a break. Realize I'm throwing difficult, befuddling, horrible questions at them that they have never heard before. So this should be really amusing, if nothing else. So with that introduction, let's get started. Lynn, I'm going to begin with you. You talk about forms of capital a lot, and on your phihealthcare.com website, you say health and healthcare are a key form of capital for retirees of any age. What do you mean by that?
So one of the concepts that I really love is this idea of a more expansive view of wealth, where, you know, when we talk about our net worth, we talk about some amount that's in a bank account. And I think that is important. And I think that's what we look at in financial independence, but we really need to look at more expansive view of wealth, like the community of people around you. I think this pandemic has illustrated there are a lot of ways to solve problems, and money isn't always the only solution for those. And another form of capital that I think is really important and often found out a little bit too late is your health capital. That's not something I presented about necessarily last time, but that's, if you don't have your health, you know, that old saying, you don't have anything. So I really believe people should look in the financial independence community more than just at the financial aspect of wealth.
Rosemary, let's talk a little bit about this more expansive view that Lynn mentions. What percentage of healthcare costs / problems are controllable? I've seen you talk about genetics versus epigenetics. Genetics is what you're born with, right? We can't change our genes. Yet epigenetics has to do with the expression of those genes, which often might have to do with our lifestyle. How much can we control and how much can't we?
Get it, girl.
Yeah, it's definitely a lot more than we think. You know, I used to, and I think a lot of people think that, you know, whatever your genes are, that's your destiny. I can't help it. You know, my parents had type 2 diabetes, so I'm going to get it too. But the reality is that your genes are essentially turned on and off by your lifestyle, the way you eat, how you sleep, how you manage stress, how much sun exposure you get, and other, you know, hormetic stressors. So there really is a lot that we can do. So I'd say a huge percentage. There's a phrase that your genetics load the gun, but lifestyle pulls the trigger. So if you're going to say a percentage might be a little hard because this issue is very nuanced, but just a lot more than we think. Maybe you can probably get 80% of the way there by changing your lifestyle, for sure.
I love that. Genetics holds the gun, but lifestyle pulls the trigger. That's excellent. Jackie, you wrote an award-winning book, Money Letters to My Daughter. And in it is a series of letters where you tell your daughter about financial issues. Was there a letter on healthcare, and why or why not?
I'm trying to think. There was a letter on healthcare, and I think it had something to do with you're young and healthy. High deductible plans are a huge deal now because the premiums are dirt cheap. The premiums are going to go to the insurance company and it's sunk cost. So while you're young and healthy, it's a great chance to take advantage of much cheaper insurance. And guess what? You get this extra account where you can save the money that you would have given to the insurance company and you can invest it. So I do remember that letter. And even though at the time she was a teenager, she certainly didn't get it at the time, but now she's 24 and she's asking all those questions around health insurance, because guess what? In a little over a year, she's going to have to get her own insurance.
Lynn, let's talk about all these questions about health insurance. We are going to dig into specifics, but I want to take another quote from your website. You say, health insurance, it's the biggest unknown in fire planning. And one thing about financial independence that I found is most things aren't as difficult as they seem if you know the right tip or trick, right? If you know the hack, your finances get much easier. Talk about health insurance. Is there an easy button? Is there some primo option that we just don't know about?
I don't think there's an easy button. I think that the FIRE movement is comprised of some of the smartest, creative, efficient, brightest people. And there are hundreds of articles on this subject. There is no easy button. I think it can be made much easier by crowdsourcing the information, but I don't think there's a terribly easy option. For most people, there's a couple of options that I recommend people look at, which is to go to ehealthinsurance.com is an aggregator. I have no relationship with them or anything. Has a nice aggregator and it compares options. And the other consideration, which is not actually health insurance, and I want to do a lot of cautions about the pros and cons, but Health Sharing Ministries, which is not health insurance. I said that twice. On my website, I detail the pros and cons of each of the plans. There's a lot of considerations to do about your specific situation that I think are important. So there's no easy button, but I think by crowdsourcing the information, we make it easier.
Rosemary, you and Jackie share this commonality that your lives have changed quite a bit in the last year. I should congratulate you. You left your job to work full-time on Flourish Fundamentals in late 2019. So this is a very real issue for you. I believe your husband works for himself. What did you guys decide to do with insurance at that time?
Well, honestly, right now, we don't have insurance, which I know is a problem and we need to get there. Having said that, I feel like the training and experience that I have with nutrition, I feel really confident that for the basics, I can take care of myself, which is really great to know. I know that the body's default state is health. And as long as it gets those building blocks that it needs, it can be healthy. And so as long as I'm continuing to eat well, move my body, get sun exposure, sleep, stay hydrated, all of those things, the body's always seeking that state of balance. We call it homeostasis. So as long as I'm doing those things, I know that my body's default state is to keep me alive and keep me healthy. So while we'll definitely have to, that's inevitable that we'll need to pick health insurance back up again, I definitely feel a level of confidence that I can take care of myself and my family, which was kind of one of my goals of doing the nutrition training in the first place.
That is a controversial stance. Susanna in the chat room asks, what if you get hit by a car?
I know. And that's the reality of why it's going to need to be a case, why we'll need to get it eventually. And, I left my job probably a little earlier than I should have financially, but it was just taking such an emotional toll on me that it was making me sicker to be there. So maybe it wasn't worth the healthcare in that respect. But yeah, as soon as we can, we'll be getting some sort of high deductible plan because, if I get hit by a car, don't give me kale, right? Take me to the emergency room. But for things that are the more diseases that are from inflammation or metabolic dysfunction, that I've got to hold on.
Yeah, people don't realize there is a safety net. If you go to a hospital sick, you will be taken care of. The issue is, will it bankrupt you or not? So it's not life and death per se, but it is your finances, and certainly catastrophic healthcare coverage is out there. Jackie, this must have been a similar concern for you. Were you reticent to retire early, and what healthcare decisions did you make at that point?
Well, I definitely had some anxiety around the health insurance piece after I retired because I was one of those people that worked for corporate America for my entire life, and I got dirt cheap health insurance. Like for me and my daughter, I think I was paying like maybe $100 a month, dirt cheap. So all of a sudden now I don't have that nice subsidy that I got from my company. So I had a whole list of things that I looked at when I consider health insurance. Like Lynn mentioned, again, it's not health insurance, but the health sharing ministries, I opted not to do that. I'm pursuing my master's degree with an online program. I was looking at getting my insurance there, but since I was doing online versus in person, that was an issue. What I finally settled on was I went to the healthcare.gov exchange. I live in Ohio, and the exchange is very state specific and to a degree, very county specific. So I had heard all these things, right, about the exchanges. They're too expensive. Oh, I found a good deal. So finally I decided to do the digging for myself. And the state of Ohio had 45 different plans for me to choose from. Plus, when I started doing the math on what my adjusted gross income was going to be, I was able to qualify for a subsidy, and I was able to get like an amazing Cadillac plan, not even a high deductible plan. I think it was zero out of pocket, or I'm sorry, it was zero deductible, $1,200 out of pocket, and it was like $450 a month rack rate. And after my subsidy, it ended up being like $55 a month for this Cadillac plan. So it worked out great for me, again, for my state, my county. So it's definitely worth taking a look at, because I was almost ready to get COBRA, which was ridiculously high because I no longer had my company subsidy. That was going to be like maybe, I think $550, maybe $600. It was a crazy amount. So I settled on my my state's ACA exchange.
Yeah, I wanted to add to that. That's very true. If you go to the general website for the health insurance, it'll take you to your state specific area. And each state operates differently, very differently. In the state of Washington, tends to be very high deductibles, which is good. It qualifies you for a HSA, but I see deductibles, or high deductibles and high out-of-pocket max. I see out-of-pocket max of around 14, 15,000. Reasonable monthly cost, but I think the subsidies relate to monthly cost and not deductibles. That's sort of what I'm seeing. So it's going to vary a lot state to state, but you're absolutely right, Jackie, in going to the main healthcare.gov site, and then it'll route you to your state specific. And that is one option. I like e-health insurance because it shows this graph and you're able to enter what medications you're on and such. And so it shows to see what is your monthly cost and your deductible and your out of pocket, so you can do a comparison of that.
Lynn, William McVeigh in the comments actually suggested that maybe the Affordable Care Act is the easy button. I worry, though, at the possibility that it could be changed. Politics play a role in our healthcare system, and there has been a lot of talk over time about getting rid of parts or the Affordable Care Act as a whole. Lynn first, and then Jackie.
Yes, I think what we're seeing is an evolution of the ACA where, well, if you guys want to dig real deep into this, I like the What the Health podcast, which is put out by the Kaiser Family Foundation. And what we're seeing is an evolution of the ACA where we're doing things like meeting the requirements by having a nice, reasonable, adjustable monthly cost, but perhaps a large out-of-pocket max, or that would also bankrupt a lot of people. So I think what we're going to see is a continued evolution. What I tell folks, because they wonder what to plan, and for healthcare, for a lot of folks, it's more on the order of a mortgage payment, not on the order of a car payment, potentially. And that's why Rosemary's information about preventing and not being so subject to just the whims of the healthcare industry. We kind of think about our house, where we wouldn't just let termites in there and then buy the best, house insurance possible. We try to do a little of both, or a lot of both, where we try to prevent the healthcare costs down the line and also have reasonable insurance. So yes, I think we're going to continue to see evolution of healthcare costs. They're growing at over the cost of inflation, and they're 18% of our GDP, which is twice as much as most industrialized countries. Yet we have no better outcomes.
Jackie.
Wow. Yeah, this whole state specific thing as far as whether or not the ACA is good or bad. So when someone is stating their opinion that, oh, the ACA is horrible or the ACA is great, it really matters where they live and what exchange they're looking at. But the one thing I appreciated when I was doing my research is that I could put in my physicians, I could put in my medications, and there was so much information that I could put in to be able to refine my search to make sure all of my providers and what was important to me was included in the plans that I looked at. So as long as they met that criteria, I was good to go. And again, I ended up with like 45 different choices that worked out great for me. For the longest, I was on a high deductible health plan, so I was used to the big, $10,000 family max out of pocket. And what worked great for me is I was maxing out my health savings account, and mine is well worth over $100,000 now, where I can still use that HSA money for out of pocket, even though I'm not on a high deductible plan. So if something catastrophic happened, like I got in that car accident or I got cancer, whatever out of pocket, I can still use my HSA dollars to cover that.
Jackie, I love this fact that we talk about the HSA as a great retirement hack, but you can actually use it for healthcare. Like you don't have to use it as another, 401k, Roth IRA, et cetera. Rosemary, we've been talking a lot about the Affordable Care Act. There are some other options. You talked about not having insurance right now, and I know that you're a woman of faith from reading your blog. Was there any thought for you guys of health sharing ministries? Why or why not?
Oh, that's interesting that you say that. It's funny. I was raised in the church, but I'm not really a part of it now. But yes, we've definitely considered it. I think at this point, it really is just a matter of like getting our revenue up from our own, hustles. It is obviously a very precarious position to be in to not have health insurance right now, just because it is like, it's a risk. It's fragile. And I recognize that. But I think that might be, if we were to go that route, it might be looking into something like that. I don't want to be dishonest and like say that I'm part of a church or something like that just to join a health sharing ministry. And I don't think anybody should do that. But I think if you do go that route and that's something that they require, then, be honest about that.
Lynn, there are some downsides to health sharing ministries. You made a point of saying that they are not insurance, and Jackie a little while ago said she looked at them and decided against them. Lynn, what are some of the downsides?
Well, they're very clear that it's not actually considered an insurance. Your contribution is considered a donation. It's like a bunch of people get together and they contribute a share. And if you have an expense, they operate differently, but if you have an expense, you tend to front load pay and then get reimbursed. There's a lot of exclusions to that. If you do sinful activities, fertility treatment, well, I don't know if treatment's not available. Vasectomies are not covered. Usually birth control is not covered. They're very clear to say that they're not technically a health insurance. It's a group of people pooling money, and because of that, they can self-select for the healthiest members of the population. And so if anybody, for most chronic conditions, those are excluded. And on my website, I started listing them out because I really want people, if they're really considering health sharing ministries, to take this into consideration, the downsides of, not to exclude it. People need to make their own decisions, but to really understand some of the pros and cons. The pros are the cost. The cost tends to be quite a bit lower than, it depends on your state in the ACA plans, but it tends to be on overall, if you can get accepted, quite lower. But I want people to make sure to look at all the cautions.
Go ahead, Jackie. You're on mute.
Sorry, am I good now?
Yep.
Yeah. So I I decided against the healthcare ministries or the health sharing ministry because I'm a sinful person. I I do things that they consider sinful. Okay, I might have more than 2 drinks in a night. You know, I take birth control. I do things that I don't necessarily consider a sin, but based on their standards, it's sinful. I'm a single woman. So when I was reading through this exhaustive list of things that they are not going to cover, it was not going to be good for me. And I just knew that it wasn't a match.
Rosemary, you talk on your blog about hacking housing costs by doing house sitting and going from place to place. One of the healthcare hacks that we sometimes talk about, but don't go into depth about, is this whole idea of geo-arbitrage. Have you ever thought of leaving the country? I see in our webinar chat that Anne has mentioned a few times getting healthcare outside the United States. Has that ever crossed your mind?
Yeah, I spent a significant portion of my 20s overseas. I lived in New Zealand for 5 years and then Ukraine for 1. So I've sort of had a broad spectrum of all kinds of, access to varying types of healthcare overseas. Some stuff was, at the time, I was still under my parents' insurance, and some stuff would be covered a little bit, but mostly I just found when I was overseas, I have New Zealand residency, so I was really lucky to be able to have access to free healthcare there. And then Ukraine, just the cost of living there is so much lower. So anything I needed done there was just way cheaper than what it would be in the US. But yeah, if I could go back to Eastern Europe, I would, like, in a heartbeat, because I loved it there. The quality of life was good, and the cost of that sort of stuff was very low.
Lynn, is this a uniquely problem in the United States? I mean, are people looking to pursue financial independence outside the US having the same issue with health insurance?
You know, that was something I was going to mention at the outset, is that this is a problem that I see most commonly in the US. And so those of you who are outside the US can look at us and at our trials and tribulations around healthcare, that we have some of the most expensive healthcare, actually the most expensive in the world. And I think coronavirus highlights I'm not going to get political, but it highlights the curiosity around healthcare and finance, both at an intersection. So what I hear from feedback from folks on my website is mine is US based, and really I think there's probably issues with healthcare outside of that, but I think it's a particular issue for those who are based in the US in terms of not only cost, but access.
So Jackie, let's break it down for people listening. If you are in the US and you're planning on retiring early, how did you decide how much money to put aside for healthcare, especially since healthcare is so unknown? We don't know what's going to happen. We don't know if we're going to get sick. We don't know if we're going to get into an accident. How do you add healthcare into your FIRE budget in a reasonable manner?
Okay, so for me, I budgeted for what it was going to cost on Cobra. So I went higher than what I thought I needed to go. Again, I'm looking at this 2 years out, right? So I had not done research on many other things, and I thought Cobra was the way to go. So for me, that was like $550. And then as I was getting closer, I was able to really dig into all these other options. Now, I still kept the budget of the $600 or whatever. The premium is only a part of it. So as I was budgeting, there was premiums, and then there was my out-of-pocket cost. And then I guess the highest amount would have included the max out-of-pocket. So yeah, I ended up budgeting for about $550, but I had to come up with some number. So it's not impossible to, retire and do the healthcare piece, but you do have to budget for it. If it was a family of 4 that was, needed to budget for it, you got to put those numbers in. But just remember, if you're budgeting in kids, the kids aren't going to be there forever. The kids aren't going to be a piece of that puzzle forever. So when you do the math, you don't need to include that. So for me, my daughter was, she's not quite 26 yet. So I included her in that budget, but only for a couple of years, because once she was off, things would be a little bit less. But I just didn't want anything to get between me and retiring early. So if that had to be a bigger line item than I was happy with, then so be it. But I certainly did my research, and I was able to, lower that price significantly, at least for now, because who knows what, next year, the year after is going to look like.
Rosemary, I'm looking at a lot of what's being said in the chat room and listening to what Jackie says about how, children are part of your life maybe now, but then they might go to college and leave. How do you decide your healthcare budget? Is there a fudge factor? You do not have children right now. At some point, your numbers might look completely different. If you're someone who's looking to reach financial independence, possibly retire early, how do we figure out that fudge factor?
This is somewhere where I'm going to have to pass. We don't plan on having kids. So far, our projections have just been, just the two of us. So probably Lynn or Jackie might be able to answer that better.
Lynn, fudge factor, how do we decide with all this unknown how to actually set that healthcare budget? Because there's tons of us who are interested in financial independence, retire early. And a big part of that is trying to allocate that budget correctly.
Yeah, so I have kids. I am planning to keep them even after having 77 days with them. Not that I'm counting.
Who's counting? Yeah.
I think, well, what I look at is what are the costs of the average family of four in the US? Like the costs, not when you're an employee, you on average cover about 16% of your costs, and the employer covers 84%. This is all average.
Right.
So the cost for a family of four in the US is about $20,000 a year. There's some variation in there. So it's not some like $100,000 a year amount, and that's a huge amount. That's a very big amount. So you kind of look at what risk are you willing to assume, what variables. But I think the best advice for folks is to truly go in and try out what is on the market now. You can test it out. And right now, I think in a lot of states are opening up more enrollment. So you can actually get real concrete numbers for your family in your zip code rather than having some pie in the sky amount. And the amount that you qualify for now is the closest thing we can get to accurate, because we can't know what's going to be up or down from there, but it's the closest starting point. And so there is, yes, so about fudge factor, I think in some ways in the fire community, you learn to embrace uncertainty. Because if we try to plan for every possibility, every uncertain situation, none of us expected to be here like this, that, okay, this is uncertain. How are we going to move through this? How are we going to use those different forms of capital and knowledge and crowdsource and figure out the solution to these problems?
And Lynn, we haven't really talked about the independent insurance market here, but I'm assuming if you do not qualify for subsidies from the Affordable Care Act, it's going to be pretty similar whether you go ACA or just independent insurance. The numbers are going to be the same if you're not getting subsidies. Is that correct?
What I've seen when I test it out for our family is it tells you, gives you options that this is an ACA compliant plan or not. And those are private insurers that are, funneled through that framework. So there are different options you can buy, and I've seen some in chat. Some people have short-term options, and those short-term options tend to be, they're through private insurances, and they tend to cost less, and they tend to not necessarily be ACA compliant. ACA compliant requires things like mental health benefit and some other, so those can be less of a monthly cost. But I'm not sure if I'm even answering your question. I'm just going down my healthcare rabbit hole. Yeah. Did I answer your question, Doc?
You did. I think the point being is that if you buy, so the ACA, the Affordable Care Act, Obamacare is a funnel to private insurance, mostly depending on if you qualify for Medicaid, et cetera. So if you end up with a private insurer, you're pretty much getting what you would on the independent insurance market if it's ACA compliant. There are some non-ACA compliant plans that you can pay for that are probably less, but it's buyer beware. You have to make sure you understand what you're getting and what you aren't getting specifically.
Right. And I think that I'm sure that there are plans that are outside of that funnel too, that are private plans. And there are certain plans that are specific to certain groups of people. We're going to see an interesting evolution of healthcare, I think, in the next 10 years. So it can be convoluted, but that is a good starting place, I think, for most of the population to start to weed out what's available to them.
Jackie, you had a point?
Hey, yeah. I just saw a couple things in the chat box about, the subsidies and how much and your age and things like that. So the numbers were always really important to me when someone was talking about anything about, fire, health insurance, or anything like that. So for me, I was 49 when I retired. I'm 50 now. So I retired December 2019. I live off of my expenses are about $40,000 a year, and that was my budget. Now, for the state of Ohio, I don't know if it's different in other states, but in order to qualify for a subsidy, it starts at $18,000. That's the best subsidy that you get. So I started looking at where my money was coming from, because retiring early, you can decide where you want your money to come from, if you want it to be taxable or not. When you're working a W-2 job, you don't get a choice. You get the check and that's it. And that's your taxable income. But it's based on AGI, adjusted gross income. So part of my income was coming from, could come from Roth IRA contributions. It could come from after-tax investments that I have. So when I'm figuring out my AGI, I want it to come in at around $18,000, maybe 19,000, maybe 20, but that's the window of my max subsidy. So you need to look at the rules for your state. All you got to do is go to the healthcare.gov, you click on your state, and that's where you're going to get the rules. Again, I was going down a whole different rabbit hole, just going off of what people were saying their individual experience was. So you do have to run your own numbers. And when I saw that $18,000, that was the number for the state of Ohio, I started figuring out, okay, if it costs me $40,000 to live, how do I adjust things or engineer it so that my adjusted gross income is $18,000? So I just backed into it.
Rosemary, I want to add in a slippery subject right before we get to Slido, which is coming up in a few minutes. But a lot of this conversation has talked about personal responsibility versus insurance, right? So you especially talked about—
in addition.
Right.
Mm-hmm.
Correct. In addition.
Yeah.
Here's kind of a big question. Should we be looking to our government to change legislation to help out with such things? I mean, people talk about Medicare for all. As people are interested in financial independence, should we be looking more to kind of change what we do, or should we expect or even push for governmental change to make the situation better? And I know this is a very difficult question.
Are we talking about governmental regulations for, recommendations of how people eat and that sort of thing? Because that has never worked out in the past.
No, I'm talking more about things like Medicare for all, where we have a universal
Lynn would
health
know more
insurance,
about that than me. Yeah.
Lynn, I know it's a sticky subject.
It is a sticky subject, Doc. You're so good at those. I really like, Doc, when you do panels, because you ask really hard questions that make me blush. I think my personal opinion, I'll share with you my personal opinion, is that we, and some people are going to love this and some people aren't, but when we cover basic education for people in the US, and people can choose to do private education if their needs are above that and their financial resources allow that. I do kind of wonder if we could do a little bit better than what we're doing right now by offering some very basic healthcare to folks, so that when they're in situations where they're in perilous health, they're not using the emergency room as their primary care doctor, because that, number one, is very expensive, and number two, is suboptimal in so many ways. So that's my personal opinion. I've been in healthcare personally, and also in nursing, and also in leadership, and I think that the way that we're operating is suboptimal. And some people are going to love that answer, some people are not, but that's my personal opinion.
At the beginning of this conversation, I asked, is health insurance the great financial independence deal breaker? But in a sense, it goes farther than just financial independence. How to pay for health insurance is a problem that people who are financially savvy have, as well as people who are not interested in personal finance. So I think the topic is much more broad than just our financial independence community. It's a good question and a difficult question. You might believe in universal healthcare, you might not, but certainly it seems like maybe we could do a little bit better, incrementally better than where we are today. And for those of us who are planning on early retirement and have been doing the financial independence planning, it certainly would be nice to have a more concrete way of going about healthcare. So you've heard us all talk quite enough. Lynn, why don't we go over to the Slido questions and see what the community has to say?
Yes, we have some really, really good ones, and they're difficult to answer. Could we talk a little about elder care, about affording quality elder spaces versus state-run facilities and their dangers? So Doc, what do you think of that?
That's a great one for Doc G.
Yeah, so I am a physician and have spent a lot of time taking care of elderly in the office, in hospitals, in nursing homes, as well as part of hospice. Elder care is difficult, and it's really easy to rail against what we have in place right now because it is suboptimal, because it's profits driven, because there are a lot of things about it that don't work. On the other hand, the scary truth is that we need to be able to take care of people who are getting older, who have high acuity needs. And right now, our nursing home and assisted living system is probably the best we have. Could it be better? Yes. Could we have, places that were more open, that had more integration of young and old people, that were more life affirming? God, yes. Could we do this better? For sure. But we can't throw the baby out with the bathwater. These spaces are needed. We need to change the way they get paid. We need to change the way they're regulated. But go to any nursing home and you will find right now people who are putting their lives on the line to take care of our nation's elderly. And a lot of people don't have the expertise, ability, or money to do it themselves at home. So I think we need a lot of grace on both sides. I think the shell of the system we have works right now, but we need to get integrative. We need to separate the making money from the quality of care. And we need to improve. So I think it's a problem. Our elderly are not going anywhere. We're going to have more and more of them as the decades pass, and it behooves us to do a better job taking care of them.
Yeah. Anybody else have thoughts to add on that complex question?
No way.
No. There's some questions about COBRA, and I just want to mention COBRA really quickly. COBRA is the Consolidated Omnibus blah 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 Reconciliation Act, which basically says that you can take over your employer's portion of the cost of your health care, and plus usually some small administrative premium, usually around 2%. So if you've been used to the employer paying, say, 84% of the premium, which is average, it's going to be a huge jump. But where that, and it is for 18 months for every plan that I've seen, but you want to verify, where that may make some sense for folks transitioning into FIRE is if you're toward the end of your year and you've met your out-of-pocket max, you want to keep your doctors, even though the monthly premium is high. That's the population that I think it may make sense for. I don't know if any of you guys want to add anything about COBRA.
Well,
there's lots of questions and comments about COBRA.
Yeah, well, I saw someone mention, I thought that was good for only 18 months. You're correct. In most cases, it's only good for 18 months. That was going to be my bridge. And for me, I was on like the lowest silver bronze plan as I could be. It was a high deductible health plan. And my company was picking up 90% of my premium. And so I got sticker shock when they gave me what the premium would be, plus that 2% when I was contemplating, retiring from the company.
Yeah, two things to realize about COBRA. One is it's a bridge. It doesn't go on forever. Right. And the other is that if you have to pay for it yourself, it's pretty expensive. So we're all used to having our companies pay a portion of our healthcare. When you go on COBRA, they may or may not continue paying that portion. So you might have to pay all out of pocket for the COBRA, and then it's not nearly as good of a deal. So just keep those two things in mind if you feel like COBRA is going to be a long-term solution for you.
I have a question. The most popular question right now is, what is your opinion on using geo-arbitrage medical tourism to keep future medical expenses lower in retirement?
I have lots of opinions on that. I don't know about you guys.
Yeah, whoever would like to speak to that.
I would first of all say, yeah, if it's an option, move to another country. That's great. Or if you can use expat insurance, or if you have elective procedures and can get them done somewhere else, there are plenty of places outside the US where you can get good healthcare. For a lot of us, it's just not an option. Like, I am home with my 2 kids who go to middle and high school, and the likelihood of us leaving the country, settling somewhere else, and starting our healthcare there just for the moment is not likely. Maybe in the future after they're in college.
I have a section. I'm seriously not trying to promote my site, because I told you I make negative $3 an hour on it. But I have a section that has specifically, because I queried hundreds of members of the fire community, including some of you guys in the audience and on the panel. And I have 3 sections about travel and arbitrage and all related things, and some things to look at, some pros and cons. Also, the most helpful links people have told me that they're using from people who are actually doing medical geographic arbitrage. So I recommend that, because that's a really common question. For, I would say, if you're US based and you're not looking to relocate, the things that could be geographic arbitrage just for the short term are things like elective procedures, or perhaps dental are the things that I see most often people taking, like a medical trip. I've never done that. I am open-minded about a lot of things. I'm not excluding that possibility. So that's why I consulted with folks who have. I think it's sections 5, 6, and 7.
Yeah, for me, as far as the geo arbitrage, it wasn't really something I was interested in, but it was on my list of 8 different options that I considered before I made my decision. So I didn't throw anything out. And I think right around the time I was kind of listing out my options, and towards the end of last year, I saw that Lynn came out with the FI healthcare, and I'm like, man, I wish this was available when I was trying to, do my list. But I didn't leave anything out. So you just, weigh all your options. Don't throw anything out unless you've, gone through and kind of evaluated, is this a fit for me and my family? It didn't end up being the winning choice for me, but I definitely considered it.
Yeah. Do you have, next question is, oh, this is a hard one. You guys are asking such hard, these are hard topics.
Yeah.
What is, sorry, let me restart. Do you have any advice for families with chronic expensive health issues? For example, a baby with cancer, genetic mutation that causes more cancers?
A few thoughts right off the bat is, first and foremost, certain things supersede finances. So first and foremost, you have to take care of your family, and you have to get them the best care out there as best as you can. So the first thing I'd say is, you have so much stress and anxiety. It's fine to try to optimize your finances, but that can't be number one. The first thing is to optimize that health of your loved one. And it's so important. I wish that it's easy for me to say that, right? Because I'm not the one in your situation. But ultimately, the relationship, the love you have for your family member is more important than your finances. Do first and foremost what you need to do. I think the second good piece of advice on that is, for almost everything nowadays, we have this wonderful internet community of people who have done this before you and are doing this along with you. Join those communities and ask what they're doing. For almost any disease process out there right now, there is an internet-based support group, and these people have been through the financial, emotional, and physical strains that you have. So find your community, because any one of us here on the panel cannot speak to your medical situation because we're not going through it. But there are people who are. Find that support, and hopefully they'll be able to guide you and make what is an extremely difficult situation maybe a little bit easier, hopefully a little financially easier.
And I'll just mention this. Earlier, I mentioned too that even your employers, but most insurance companies, as you are shopping for insurance, they will let you put in your providers, your medications. And I would think that that's extremely important if your loved one is getting cared for a chronic illness, to maintain the consistency of the medical team, the medications and things like that. So I would definitely take the time and put in all of those factors that are important before you decide to choose a plan. And even while you're deciding on the plan, a high deductible may work out okay for you, even if you have a chronic illness, but a traditional plan may as well. So you can run the numbers. I think WEX Health has a really good calculator where it will compare your traditional health plan with a high deductible health plan, where you can put in all these different factors based on your situation. But again, anytime you're shopping for it, put in your medical professionals and your medications to make sure that's covered first, and then choose the plan.
Yeah, oh yes,
No,
Rosemary.
oh, go ahead, Lynn.
Well, no, I want to hear your wonderful thoughts.
I was just going to say, for anybody dealing with a chronic health issue, I would recommend looking to talk to a person who practices functional medicine. And we haven't really had a chance to talk about this too much, about kind of the contrast between sort of allopathic, like traditional medical model, which is centered more around relief care, and then sort of the functional medicine approach, which is sometimes referred to as just 21st century medicine, which is a more functional model that is focused on finding root causes. So instead of just relief care, it really is like corrective and maintenance care, finding out why is this inflammation happening? Why is the immune system like enraged and fighting everything, and a lot of the time it's because inflammation, because of diet and, the way that we're eating. And so instead of getting stuck in this endless, expensive AF loop of like drugs and surgery, instead looking for addressing those systems upstream and removing those stressors and strengthening the body's defenses, and a functional medicine practitioner can help you do that. So I think that's one of the limitations of our culture, is that we always think outside in, but we don't consider that equally important is inside out. So working with somebody that can help you identify and address root causes is really important with chronic disease. It's usually inflammation is just at the root of everything. So it's getting to the root of that fire, that inflammation, and putting it out.
That's perfect. I was hoping you would jump in on that aspect. One quick actionable thing, and then I'll bring it back to Doc to close us out. Folks who have chronic conditions, and a lot of conditions are inflammatory based, and we're certainly seeing that with coronavirus, for example. It's a lot of inflammation. That's how the body's responding. But one actionable thing is, if you have an expensive healthcare situation, on average, it makes more sense to have a higher monthly cost plan, which is inversely related to the deductible and the out-of-pocket usually. So insurance companies are smart. They want to get the most money possible. So if you have known fixed expenses that you think it usually makes financial sense to have a higher monthly cost and a lower deductible and out-of-pocket. So as you're considering that, take that. And opposite is true if you're a lower utilizer of healthcare. Nobody has a crystal ball, but those are some things to consider. So thank you guys so much, Doc. Over to you.
All right, Jackie, close it all out. I want to go through all three of you. Give me a 1 or 2 sentencer, summate everything for us. If you are interested in financial independence, retire early, you are looking at that retirement date, you're worried about healthcare, can you give us a 1 to 2 sentencer? Where do we start? What do we do?
Yeah, you want me to go first, Doc? Yeah, definitely start with a broad list and work in. Okay. At first, when I thought that it was just COBRA, I was really limiting myself. So I came up with about 8 different options, even ones that I 90% knew wouldn't work. I put them in there and I did the research. Now, Lynn's FI healthcare website will make that process a lot easier, but start there. And even if it ends up being a larger amount, let's say $500-600, it might sound ridiculous, but if that is the system we're working in today, just budget it in. So that's what allowed me to go ahead and retire early and to kind of move this mountain that was on my mind about getting health insurance after I retire. It doesn't have to be an obstacle. And if you start to knock it down piece by piece by looking at all of your other options or simply budgeting it in, you're going to be okay.
Rosemary, last words. Someone worried about healthcare, interested in FIRE, what can they do?
Yeah, my big thing would be get yourself, prepare yourself, just take it into account that you may need to spend a little bit more money and time and effort creating an opt-in self-care model so that you're not forced into a disease care model later on.
Mm.
And Lynn, last words of the panel, FIRE and healthcare insurance or healthcare in general, 1 to 2 sentences. Where do people start?
I think where people should start is coming together with other people who have the same problems to help figure out how to navigate this landscape, because it's dynamic and ever changing. And I think your social capital that you have built around you, I think I have five sentences now, but yeah, I think that's one of the biggest tools that you can use, is learning from the knowledge of those who are fighting the same battle.
I love it. And that's exactly what we're doing here today with this panel at Camp Mustache, is coming together to talk about the difficult things. I imagine many people in the audience will want to reach you guys, read all your material, and maybe even contact you. Jackie, how can everybody reach you? Where should they go?
Okay, they can just visit me at moneyletters2.com, and that's moneyletters, plural, and the number 2.com. And all of my social media and all of that is on there.
Rosemary, where can we go to learn more about functional nutritional therapy, debt slaying, and a slew of other issues? How can we find you?
Yeah, you can, my website is flourishfundamentals.com. You can also email me. I'm rosemary@flourishfundamentals.com. And I do just want to say, like, having been someone who was really sick for most of my life and found that I was able to just get a lot better by the way I ate and I moved, I'm so motivated to be able to help other people who don't feel like there's hope, and to help you know that there is hope. So I'm so happy to help. If you have questions or just want to talk about something, like, please reach out to me. It's really important to me to be able to help.
And Lynn, where's the best place to find you and attack all those wonderful resources you have?
Yeah, so I'm going to come clean here, just like Jackie did earlier. I hate email and I don't like details. And this is an area that's really interesting for people. And so I think I'm going to need some help. So if any of you out there are thinking, boy, sounds interesting, I'd like to help Lynn with managing emails, supporting people, and helping with the website, send me an email at hello@fihealthcare.com. It is fairly self-explanatory. You go into the knowledge base and I give away the password, which is community. But that's the best way. I love seeing people in person. I do. And so I kind of limit my time on email, but I recognize that that's a common path. So I think I'm looking for folks to help me with that area. So I'm being honest here, coming clean.
This has been Camp Mustache 2020 virtual, the Financial Independence Healthcare Panel. On behalf of myself, Doc G, Jackie Cummings Koski, Lynn Frair, and Rosemary Fatheringham, we wanted to thank Kristen, Joe, and Alma. That's a wrap.
Thank you so much, Doc G. Thank you to our panelists. Really
Thanks,
appreciate
everyone.
you coming, dealing with our technical difficulties, and giving some folks a lot of really helpful information that may literally save lives in our community and around the world. Thank you so much. We've got an afternoon break, and in a couple hours we will be back for breakout sessions number 2. We've been having some email problems, so if you are registered for Camp Mustache, either donating or not, but if you have registered in any way, shape, or form, and you haven't gotten an email from us with the Zoom information for the rest of the day, please send us a message on our Facebook page. We will be checking it throughout the break to make sure that everybody who wants to can participate for the rest of the afternoon. I just posted a link to the Facebook page, so you should have it in the Zoom chat. Yeah. Yeah, so have a good afternoon break if it's your afternoon, or whatever time of day it is for you. And thanks again to all our panelists. See you at the next one.
Bye, everybody.
Bye.